So, Steve, when we've got some doctors that have used PowerNote quite a bit and are very comfortable with PowerNote, why do you like DynDoc more than PowerNote?
Primarily because DynDoc looks like a dictated chart. Its appearance is very nice, very clean, doesn't have extraneous information. I started off dictating notes in PowerNote using a generic note that had just a blank history. And basically you would just start off, this is a 27-year-old female with a prior history of so-and-so, and then off you would go. But even with that, PowerNotes are kind of choppy. They don't organize your notes in a way that looks very pretty, put it that way.
So what was I think we've got a lot of physicians that are worried about making the migration. You know, they're very comfortable with PowerNote over to DynDoc. How difficult is that leap?
A little bit of a learning curve. If they're comfortable with PowerNote and want to get by with PowerNote initially while they struggle with the other aspects of the go live, that would probably be fine. And then what they could do is then pick up DynDoc once they feel like they have the time to actually learn it. We can get them started or show them, how to do DynDoc, and they can make that switch when they're more comfortable with it. Some people just like sticking with the old, PowerNote, and they're still doing PowerNote to this day, especially those docs that have scribes. But the ones of us who prefer not to work with the scribe, who prefer DynDoc, we make the switch pretty readily. It just depends on when you want your pain. Do you want your pain now and get it over with, or do you want it later on? So it's hard. Go lives are tough. There's nothing easy or fun about a go live at all in a new EMR. Now that's the one big advantage of PowerNote compared to DynDoc. PowerNote, every time you open a note, automatically refreshes all the sessions. DynDoc, you have to know that you have made a change and then just click on it. So you end up, as you create your note, toward the end when you're doing your MDM and closing your note, you may go back once or twice and click on a few refreshes just to get it up to speed, like anything the nurses added, most recent vital signs, or all your lab results or radiology results, etc.